y'all talked a lot about like making relationships with the patients, and I was wondering what has been one of the most memorable moments you've had when working with the patients during the mission trip at your time.
Most memorable experience. A couple things. My parents went on their first trip with me last year.
And I was there.
Yeah, in the fall. This is a big deal because my parents, my parents have known, they've known I had this desire to be involved with this organization, become plastic surgeon for such a long time. And so for them to go and see what we were doing was very emotional for them because
they were so proud. Yeah.
They're very proud. They were pitched in. They did as much as they could do, and they were awesome. And it was great to have them on the trip. That's one definite memory I'll never forget. I think that was very special, sharing what we do there in Guatemala with them. I think the second is seeing the kids that we've taken care of in the past and seeing them again. And these kids are, and their families, their mom and dad, they're just so affectionate and they want to hug you and just show their gratitude for what you've done for them. And I think that is just an amazing experience.
Yeah, it's tremendous to see the kids from before. And a lot of these folks, they're stoic. I would classify them in that way. They're kind of quietly emotional. Now, when you bring the babies down from the recovery room after surgery, that's when the emotion comes out. That's when you see the mamas cry and hug their babies. They've been worried, even despite all our best efforts to provide good patient education. A lot of them have never been in these environments before, and so they're just kind of overwhelmed. They don't necessarily ask questions. They're just grateful to be there, right? So they don't know what the hell is going on up there. And so they see their kids and they see that their lip is fixed and this monumental problem is now behind them and their kid is alive. And it's just, those are the highly emotional moments for me. I'm not much of a crier, but I've welled up before because it's just very impactful.
So have you always known that you wanted to go into medicine? And what are some things that you would recommend for students or people who are interested in becoming surgeons or going into the medical field?
I've always known I wanted to be a doctor ever since I can remember. There really wasn't another career choice for me. The question was which specialty, and I made sure that I tried to see as much as I could. So for instance, when I was in high school, I shadowed a plastic surgeon in Austin. And then when I was in college, I applied for and was accepted to the Baylor College of Medicine DeBakey Summer Surgery Program and worked an entire summer in cardiothoracic surgery in the operating room, scrubbed in every day. It was brutal. I knew I didn't want to be a cardiothoracic surgeon. After that experience, I also rotated when I was in college with a general surgeon, a local general surgeon, and went and observed surgery with him. So I'd be in the operating room and ask questions, see surgical procedures. So, little by little, I kind of reinforced my decision to become a plastic surgeon, which was instilled with me when I was 13, when I was exposed to plastic surgery. And we talked about that earlier. So I think the things that you can do are get as many experiences as you can. Surgeons will let you shadow them. For instance, at my facility where I operate, we love having students come shadow. We think it's one of the best things that we can do. We like teaching, we like educating. And so, you're welcome to come join us at our facility. You just have to let us know in advance and we'll get you cleared by our nursing staff. So that is a big thing. Get as much exposure as you can. I also shadowed with a primary care doctor in town when I was in high school as well, because I just was interested in that and picked up a volunteer job doing chart filing back then too. So I think, as much as you can get, as much exposure as you can get, do it. Get involved with groups like Austin Smiles. This is amazing. Get involved with the fundraising side of things, or getting things ready for the trips. All the preparation that goes into these trips takes a tremendous amount of volunteer hours, and there's lots of opportunities from there.
When you're going through medical school, same thing, and get as much experience as you can. And don't be afraid to change your mind. Keep an open mind, because you may surprise yourself. You may end up drawn to another specialty and you never thought that would happen. You may intellectually like plastic surgery, and then when it comes around to actually dealing with other surgeons and getting in the OR, it may not be your thing. And there's absolutely nothing wrong with that. So just keep an open mind, and you have time in medical school to make the choice. I mean, I went to medical school and I thought I was going to do like women's health, OBGYN. Oh my God. That went to the bottom of the barrel for me with more experience. So that would have been a disaster specialty for me. So I was willing, obviously, to keep an open mind. And so I did general surgery, and I liked that quite a bit. It's just more problem focused. You're not treating the whole patient. You're not treating a non-compliant diabetic and who's got hypertension, and you're managing these medications. I ended up finding out I was not going to be that kind of doctor. So I'd rather solve problems, and I'd rather have a narrow focus and do things with my hand and have immediate gratification of surgery, right? I think with plastic surgery, it brought the most variety to the table. And so I wasn't as concerned for getting bored, simply because you're doing head and neck stuff. You're doing soft tissue reconstruction all over the body. You're doing breast, cosmetic and reconstructive. You're doing all sorts of cosmetic stuff, which is fun. And you're doing hand surgery. A lot of people don't know that plastic surgeons are trained in hand. And then all the microsurgery stuff that I don't do anymore. But, there's certainly a huge diversity to plastic surgery. And so I think if you are inclined to be a surgeon, I think there's probably something within plastic surgery that would interest you.